You wake up one morning feeling more tired than usual. Nothing terrible, just off. Maybe you slept poorly. Maybe you're coming down with something. So you brush it off. You go about your day, and 3 hours later, you're in an ambulance fighting for your life. Does that sound extreme? It shouldn't, because nearly half of all heart attacks are silent. 45%. That means no crushing chest pain, no dramatic collapse like you see in the movies, just subtle, easy-to-ignore symptoms that your body is screaming at you to pay attention to. And if you're over 60, your risk of having one of these silent attacks is even higher. So if you think a heart attack always announces itself with that classic Hollywood chest-clutching moment, you are dangerously wrong. Stay with me for the next few minutes, because what I'm about to share could genuinely save your life or the life of someone you love. My name is Dr. Wyatt Sterling, and I've been practicing for over 12 years. I've treated thousands of patients, and I can tell you from experience that the ones who survive heart attacks are not always the healthiest or the youngest. They're the ones who recognized the warning signs early and acted fast. The problem is, most people don't know what those signs actually look like, especially seniors. Let me explain why.
As we age, our bodies change in ways we don't always notice. One of those changes happens to the nerves that carry pain signals from your heart to your brain. In younger people, when the heart is in distress, those nerves send loud, unmistakable alarm bells, sharp pain, pressure, tightness in the chest. But in older adults, especially those with diabetes or years of high blood pressure, those nerves can become damaged or less sensitive. This condition is called autonomic neuropathy, and what it means is that your heart can be dying and your brain might only get a whisper instead of a scream. That's why nearly 1 in 3 heart attacks in seniors goes completely unnoticed until it's too late. Some people only find out they had a heart attack weeks or months later during a routine EKG. By then, permanent damage has already been done. So today, I'm going to walk you through 5 silent warning signs that most seniors ignore. These are not the obvious ones. These are the sneaky ones, the ones that masquerade as something harmless. And I'm going to explain exactly what your body is trying to tell you when these symptoms show up. Don't skip number 3. It's the one I see misinterpreted most often in my clinic, and it's cost people their lives. Sign number 1. Sudden, unexplained fatigue. Now, I know what you're thinking. I'm 70. Of course I get tired. And you're right, fatigue is common as we age. But I'm not talking about the kind of tired you feel after a long day of gardening or playing with your grandkids. I'm talking about the kind of exhaustion that hits you out of nowhere. You're sitting in your chair, you haven't done anything strenuous, and suddenly you feel like you could barely lift your arms. Or you find yourself needing to nap multiple times a day when that's never been your pattern before. This kind of fatigue happens because your heart is struggling to pump enough oxygen-rich blood to the rest of your body. It's working harder than it should, and that effort drains you. I had a patient, Margaret, 73 years old, who came to see me because she kept falling asleep during her favorite TV shows. She thought maybe she needed more vitamins. Turns out she'd had a silent heart attack 2 weeks earlier, and her heart function had dropped significantly. If she had waited any longer, we might not have been able to help her. So listen closely. If you suddenly feel exhausted for no clear reason and it doesn't go away with rest, that is not normal aging. That is your heart asking for help. Sign number 2. Pain in your jaw, neck, shoulders, or upper back. This one confuses people all the time because we've been taught that heart attack pain happens in the chest, and it does, but not always. Here's what's happening. Your heart and your jaw share some of the same nerve pathways that lead to your brain. When your heart is in trouble, those pain signals can get scrambled. Your brain receives the distress call, but it can't always pinpoint exactly where it's coming from, so it interprets the pain as coming from your jaw or your neck or between your shoulder blades. I've seen patients who thought they had a toothache or a stiff neck from sleeping wrong or pulled a muscle doing yard work. They took some ibuprofen and went to bed and woke up in the ICU. One gentleman, Robert, came into the ER convinced he needed to see a dentist. His jaw had been aching for 2 days. We ran an EKG just to be safe. He was in the middle of a heart attack. If he had ignored it for another couple of hours, he wouldn't have made it. So if you develop jaw pain, neck pain, or upper back pain that seems to come and go, especially if it gets worse with activity and better with rest, do not assume it's arthritis or dental trouble. Get it checked immediately. Sign number 3, mild indigestion or heartburn that won't go away. This is the big one, the trap that catches so many people. You eat dinner. An hour later, you feel a burning sensation in your chest or upper stomach. You think, oh, I overdid it with the spicy food, or maybe it's just acid reflux. So you take an antacid. Maybe it helps a little, maybe it doesn't, and you go to bed thinking it'll be gone by morning. Here's the problem. Heartburn and the symptoms of a heart attack can feel almost identical. Both cause discomfort in the chest. Both can make you feel nauseous. Both can cause burping or a sour taste in your mouth. But here's the difference. Heartburn usually gets better when you take an antacid or change positions. A heart attack doesn't. If you're feeling what you think is indigestion and it's lasting more than 15 or 20 minutes and it's not responding to the usual remedies, that is a medical emergency. I've had patients tell me they spent an entire night thinking they had food poisoning, when in reality their heart was slowly suffocating. One woman, Linda, age 68, told me she felt gassy for 3 hours before her husband finally convinced her to go to the hospital. By the time she arrived, significant damage had already been done to her heart muscle. Don't let this be you. If the discomfort in your chest or stomach feels different than your usual heartburn, or if it comes with sweating, nausea, or shortness of breath, call for help. Don't wait to see if it gets better. Sign number 4, shortness of breath without exertion. You're sitting on the couch, you haven't climbed any stairs, you haven't been exercising, and suddenly you can't catch your breath. Or you notice that simple activities that never used to bother you, like walking to the mailbox or getting dressed, now leave you winded. This happens because your heart isn't pumping efficiently anymore. When blood flow slows, fluid can back up into your lungs. That makes it harder to breathe. It's called pulmonary congestion, and it's one of the earliest signs that your heart is failing to keep up with your body's demands. It's like breathing through a straw, some people describe it. Others say it feels like there's a weight on your chest. Either way, it's not something you should ignore. I treated a man named George who came in because he thought he had developed asthma at age 75. He'd never had breathing problems before, but suddenly he was gasping for air after walking across his living room. It wasn't asthma. It was heart failure triggered by a silent heart attack he'd had weeks earlier and never knew about. Shortness of breath is your body's way of saying something is very wrong. Pay attention. Sign number 5, dizziness, lightheadedness, or sudden cold sweats. You stand up and the room spins, or you break out in a cold, clammy sweat for no reason, even though you're not hot or anxious. These symptoms happen when your heart isn't pumping enough blood to your brain and your skin. Your blood pressure drops, your brain gets less oxygen, and your body tries to compensate by triggering a stress response, which causes sweating. I had a patient, Dorothy, who told me she felt dizzy and sweaty while sitting in church. She thought maybe she was having a hot flash, even though she was well past menopause. She ignored it. 3 days later, she collapsed in her kitchen. She'd been having a slow, silent heart attack the entire time. If you experience sudden dizziness or cold sweats, especially if it's combined with any of the other signs I've mentioned, do not brush it off. Sit down, call someone, get help immediately. Now, let me tell you exactly what to do if you or someone you're with experiences any of these warning signs. First, do not wait to see if it gets better. Do not lie down and hope it passes. Do not drive yourself to the hospital. Call emergency services right away. Tell them you think you might be having a heart attack. Time is muscle. Every minute that passes without treatment means more of your heart muscle is dying. While you're waiting for help to arrive, if you're not allergic and your doctor has previously okayed it, chew 1 regular aspirin. Not swallow, chew. Chewing gets it into your bloodstream faster, and aspirin helps prevent blood clots from getting worse. But do not take aspirin if you've never discussed it with your doctor, especially if you're on blood thinners. Stay calm, sit down, loosen any tight clothing, and keep your phone nearby in case you need to update the dispatcher. I know this information might feel overwhelming or even scary, but I want you to understand something. Knowledge is power. The fact that you're watching this video right now means you care about your health. You're taking this seriously, and that puts you miles ahead of the people who ignore the signs until it's too late. Heart disease is still the #1 killer of adults over 60, but it doesn't have to be, because most heart attacks are survivable if you act fast. The difference between life and death often comes down to recognizing the warning signs and not being afraid to ask for help. So, here's what I want you to do after this video ends. First, share it. Send it to your spouse, your siblings, your friends, anyone over 60 you care about, because this information could save their life. Second, have an honest conversation with your doctor about your heart health. Ask about your risk factors, get your blood pressure checked, know your cholesterol numbers. And third, trust your instincts. If something feels wrong, it probably is.
Don't be embarrassed. Don't worry about wasting anyone's time. If you're experiencing any of the signs I talked about today, get checked out. It's always better to be wrong about a heart attack than to be right and do nothing. Take care of yourselves. Pay attention. And remember, your life is worth fighting for. I'll see you in the next video.